Cerebral palsy, the permanent motor disability, posture, tone also. So it is usually central CNS involvement. So neuropathy, some sort of neuropathy is there. Spastic diplegia is by far the commonest, around one third, 35% of cases, and quadriplegia in 20% of cases or so. Your hemiplegic diplegia, 25%, and then you have extrapyramidal involvement in another how much, that's around 10 to 15% of cases. The basic lesions over here is the, in the brain, periventricular leukomalacia. You have, the scar formation, mostly by infection and ischemia. There may be thrombophilic disorders, and your genetic causes at times there. Hemorrhage can be the underlying precipitating events. So hypoxia, the carnicterus, and if you do, in the neonatal period, the hyperbilirubinemia, and mitochondrial myopathy, mitochondrial disorders. So, a wide variety of disorders, including thyroid disorders, can cause brain involvement with permanent motor disability, long-term motor disability, and these children have, spastic or, diplegia or quadriplegia, hemiplegia, and then previously we used to call it static encephalopathy. So, how to, incidence is not that low, it's quite high, 2.5 to 3 per 1000 population in USA. And the cost, psychological and financial cost of this disease, burden of the disease is quite high, 1.2 million per annum. So it's quite high. And then treatment of those cases is quite difficult, multidisciplinary. The neurologist, the developmental therapist, and other group involvement, rehabilitation, the your anti convulsants, anti spastic medications, and other medications as the clinical scenario exists, and neurosurgical cases, the your dorsal rhizotomy, and your deep stimulation, they are also at times, attempted. So good amount of time you have some improvement. So take, when you have the opportunity to take this in a good center nearby, but with there's a good amount of time you do not have much desired benefit. So but trying and getting the optimum is essential.